Since 2018, AAKP's annual policy summit has been an exciting and timely event. The summit focuses on key policy challenges and opportunities that may impact current and future kidney care and that are under consideration in Washington, D.C. Over the past 5 years, the Policy Summit has brought greater awareness and transparency to these issues and has also introduced the patient advocacy community to some of the most influential and important movers and shakers impacting policies that determine aspects of your care, your financial security, and your life. These are professionals and experts that walk the halls of power, are deeply involved in policy deliberations, and rely upon AAKP for information about unique patient insights and perspectives. On a daily basis, AAKP is deeply involved with these and other professionals on issues of shared concern. We are pleased to have such long-standing relationships and are equally pleased that AAKP is constantly identifying new allies and introducing them and their concerns to you. For the professionals you will hear from today, AAKP has deep respect for their wide range of expertise. We appreciate the time they invest in our collaborations with them. These are experts that work in the same space as we do. They represent industry, research, and patient interests before the government, within medical societies, inside investment decisions, in front of the media, and with leaders in the White House, federal agencies, and U.S. Congress. AAKP is committed to expanding patient care choice and improving patient care options, aligning the approval of safe new innovations to payment and reimbursement decisions, and transcending status quo kidney care. We are working to reshape the policy environment to broaden support for research and innovation, and we are working with allies to level the terrain so that kidney diseases becomes a larger national priority and that all patients gain access to the safe drugs, devices, and biologics that are available and under development. This year's summit helps us accomplish these goals by exposing you to important issues and encouraging you to engage with us and allies in the coming year. Throughout the day, you will learn about issues that you can impact and how you can leverage your voice and your vote as a citizen to make a difference. So, to walk us through the purpose of today's event and what we are listening for in these upcoming sessions, I'd like to welcome a few members of AAKP's leadership team that are heavily involved in supporting AAKP's national policy and advocacy operations. We have with us today Ed Hickey, our newly elected AAKP President and Chair of our Veterans Health Initiative, Richard Knight, AAKP's Immediate Past President, and Paul Conway, AAKP's Chair of Policy and Global Affairs and a former AAKP President. Welcome, gentlemen. As ED, I have had the pleasure of working closely with each of you on a regular basis on AAKP's programs, surveys, research, alliances, and policy initiatives. So not to embarrass you, but earlier I did a little envelope calculation and developed how many years of policy expertise and experience the three of you have based on your biographies. So I think one of the reasons why AAKP is so effective is because among the three of you, you have over 100 years of policy experience in Congress, presidential administrations, political campaigns, and working alongside national stakeholder organizations. So you three really do know how Washington works and why alliances are so very important. Another reason why AAKP is so effective is that each of you apply an important lesson from your careers. You're constantly working to expand the number of patients and families involved in AAKP, and you make it a point to provide them with the skill training necessary to make an impact, and then aid AAKP in our efforts to place them in policy roles where they can impact key changes. I am so very proud of what all three of you have done to involve our national ambassadors in White House events, congressional meetings, federal agency meetings, and research and advisory committees. So with that, let's go ahead and begin our lightning round session here on what this policy summit is all about. So to get us started, Paul, as AAKP's Chair of Policy and Global Affairs, can you level set for us and tell us what the purpose of this year's Policy Summit is and what makes this year so unique?
Thanks, Diana. And I think with 100 years of experience, we probably need another cup of coffee immediately. We're starting to feel it on some days. But essentially what we're doing this year is we're listening very closely to a wide range of stakeholders, some of whom have never actually been to an AAKP event before as a participant, and we really do appreciate their being here. We're listening to a wide range of issues because this year, what we're doing is we're incorporating the insights that we're gathering in this event alongside the comments that come in from our fellow patients and our survey data to formulate for the first time a national kidney patient policy agenda. And what that's going to do for us is it's going to put down in black and white for everyone to see on paper what our priorities are as an organization based on principle and current issues. And the reason why this is distinct is because in prior years, we've worked alongside many different organizations as a trusted ally and helped advance their agenda across the board. And many of those issues have overlapped with our own. We've always been a good partner. This year, we're actually coming out with our own agenda and inviting folks to participate with us. And some of the issues that you'll see on the agenda are ones that we think are very, very important, including issues of payment and the alignment of payment to innovation, because oftentimes a lot of the discussion is about research, applied research, clinical trials, and then getting a product into the FDA to be considered and hopefully approved as safe. But then oftentimes the conversation fractures or it's not completed. We actually think that for medical professionals and for patients, it's fundamentally important to have the entire conversation from the point of concept all the way through clinical trials, FDA approval, and who pays for it so that that doctor and that patient can actually immediately apply the therapeutic. We think that that is fundamentally important. That's the type of stuff that you'll see in a policy agenda. But this discussion at this policy summit is very important so that we don't leave any issues off the table and that we don't miss any opportunities to advance the best interests of patients.
That's great, Paul. 100%. Thank you. Ed and Richard, given the purpose that Paul has just laid out for us, can you tell me what you both are listening for in the sessions that you're moderating today? Richard, we'll go with you first.
Thanks, Diana. And building on Paul's early remarks, in the sessions that I'll be hosting today, I think it's very important the topics that are being discussed from our four allies that are going to be talking today. They range from patients having access to over-the-counter medication that can deal with their pain, to payment issues, as well as precision medicine, which is more or less a new frontier. What we're going to be discussing and what I'll be listening to is how can we continue to work with them and use their resources, join with ours, to better represent our patient population. Just a small example, I went to a pharmacist the other day to fulfill a subscription and my insurance didn't cover it. Fortunately, I was able to get another one from my doctor that was covered. Now, had I really needed that particular medication, it cost $200, which is something I just couldn't pay out of pocket. Apply this to our kidney patients who may need a particular medication, could be for anemia, something that may slow the progression of the disease down, and they go to a pharmacist and get it and find out that it's not covered. So I think that the overall context of our conversation today really speaks to what AAKP, along with our allied organizations, can do to address this concern. Because as Paul said, it's great to have innovations, but if the patients can't have access to it, it doesn't really allow the patients to take advantage of some of the research and innovations that should be available to us. So I'll turn it back to you, Diana.
Thanks, Richard. And Ed, how about you? What will you be listening for in your sessions you're moderating?
But first, I have to say that's the kindest way anyone's called me old in a long time, Diana, so thank you. I'll be listening for barriers that are created within the payment and reimbursement systems. And we can advocate all we want for innovations as a kidney community, but if innovations aren't covered by CMS and insurance companies, then the efforts of our communities get undermined. We cannot let that happen. The folks speaking to us today have a wide range of perspectives, and some we will hear from for the first time at an AAKP event.
Thanks, Ed. And the 100 years collectively is something to be proud of. Definitely a century mark. So moving on, Paul, can you share with us what you'll be listening for during your session, the Under the Dome session, and then a little bit about your interview with Dr. Matthew Cooper, the former president of UNOS?
Sure. So in our session Under the Dome, which we've done nearly 8 years now, I think, at AAKP events, we have a couple of different issues that are going to be playing out in that. One are the issues that are of greatest concern to frontline doctors, the Renal Physicians Association, and our good friend Rob Blazer will be coming in to talk to us about that. Many of those issues overlap with us, and we have a long-standing partnership with RPA. Also, transplant issues in terms of policy and legislation. Peggy Ty will be here from the American Society of Transplant Societies talking to us, and we're going to be listening specifically for developments and her perspectives on the Living Donor Protection Act, which both Ed and Richard have worked very hard on over the past year to make certain that all patients and all donors are covered under the Living Donor Protection Act. And then the other thing that we'll be hearing about is some of the great work that's going on by Kelly Delmore and some of the coalitions that are involved in trying to advance dental coverage for kidney patients. So that'll be very good. And then we also, with Dr. Cooper, have an interesting perspective. Richard has been watching this very closely in his work on the SRTR. Ed has been very involved in this issue also. It's the issue of what's going on with the American transplant system, from issues of allocation to new structures, and also what the transplant organizations like UNOS have been trying to do and have done in the space to make it better for all patients, especially those in underserved communities, to get access to transplants. And so Dr. Cooper, as a surgeon at Georgetown and as a surgeon that we have recognized from AAKP for his excellence, is going to have a pretty candid conversation with us about what's going on there. We have been concerned from a policy perspective, and we've decided not to weigh in over the past year. We've been carefully listening. In particular, Ed and Richard have been listening very closely to the details being proposed by some folks who want to essentially replace the current system with another system. But to date, we've heard very little in terms of specifics. We've heard a lot of accusations against a lot of tremendously fine professionals and institutions, but we haven't seen the substance of a replacement. And we think that is highly risky for the patient population and for the transplant system. So we wanted Matt Cooper to give us a candid assessment of where things stand on that, and he has done so. He took a lot of time out, and we're honored to have had him participate today.
Great. Thank you, Paul. And thank you, Ed and Richard. I think that's wonderful and kind of gives us an insight on what we as listeners to these sessions can also kind of listen for and pick up on from our presenters. So turning to a different topic, in 2014, to support the new strategy, the national strategy of AAKP, we launched our Center for Patient Research and Education and our Center for Patient Engagement and Advocacy. Since then, the association has dramatically expanded its databases, its social media recruitment, and analytical tools, just to note a few capacities. Can each of you give me your perspective on how these centers will support the National Kidney Patient Policy Agenda in 2023 and 2024? So Ed, let's go ahead and start with you.
Sure, Diana, thanks. So we'll see a continued expansion of the patient involvement in both the grassroots organizing and direct involvement in innovations envisioned by the policies we're advocating. The center, some of the undertakings will include AAKP's first dedicated Capitol Hill Day, in addition to the days that we spend with our allies on the Hill. more frequent virtual Hill days as issues evolve and when the patient voice is most needed in Congress. Sometimes an issue will pop up, and it's helpful to be able to deploy people to address the issue quickly and get in front of the representatives and let them know how that particular piece of legislation impacts their own personal lives. And then also we'll have greater public policy research.
Thank you, Ed. And Richard, how do you see the center supporting our national kidney patient policy agenda?
Quite frankly, the creation of the centers was something that was very innovative, very different, and it allows us to focus our efforts. Being an educator, education is very, very important. And in order for our patients to really participate in advocacy, they need to be educated. So as we said, as we're going to talk about, you don't have to be a professional. You do have to have the will and the discipline to learn some of the topics. And then through working through our centers and the resources that we provide, you can use those research and discipline that you've developed and allow yourself to voice. It allows you to voice your opinion and have an impact. Many of us are very cynical nowadays because we think that it doesn't matter. Our vote doesn't matter, and what we say doesn't matter. But through strategically combining the voices of a large group of patient consumers, we are able to truly have an impact. We've been able to have an impact on legislators. We've been able to have an impact on insurance companies, on payers, and we've had a significant impact on research. With respect to research, innovations are so important to moving us from the status quo. And as an organization, we have played a significant role, and I mean a true partnership with many of these small and emerging pharmaceutical companies. We've worked with them to help better understand what patients really want, to help fine-tune their research efforts, whether it be a product, whether it be a device. So I think that as we continue to evolve, and in fact, organizations, companies, academics get more engaged with us, they'll see that we go under the banner of a patient organization, but we have a professional profile that really adds a strategic asset to many of the allies that we work with. And that's something that I think all our patients should be proud of, because they just don't go sit at the table. They go sit at the table and they add insights and knowledge to whoever we are engaging. So appreciate the opportunity to speak on this, and I'll turn it back to you, Diana.
Great. Thank you, Richard. And Paul, to wrap up this question, how do you see the center supporting the National Kidney Patient Policy Agenda?
Well, what's interesting about it is the two centers essentially are on the research side and on the advocacy side. And depending on what your personality is and what you like to do, you might be more interested in working with researchers. You might be more interested in doing some of the grassroots, and in Washington, D.C., the grass tops advocacy. And so what the staff, you folks, have been able to do over the past several years is to capture some really fantastic skill training at the practical level for how to be effective with researchers, how to get published in peer-reviewed medical journals. And then on the advocacy side, we've had some of the best in the business teaching our folks about press communications, how to work with reporters, how to organize fellow patients, how to be effective on social media. And so essentially, I see the centers as being part of the real practical center for how we engage patients in the larger fights on kidney disease. And there's an old axiom in politics, which is reach out to as many people as you can and enlist them, get them involved, train them, credential them, and then align an opportunity for them to be effective where they feel the passion that they feel about a certain issue, in this case, kidney disease, can be realized, and they feel like they are being effective. And so we feel a great responsibility, and we know that through these centers for the 2023 and 2024 year, we're going to be turning out many, many more patients that are well qualified, well trained, and highly effective in order to advance the agenda. The other thing, and Richard has worked on this for a long time at Bowie State University as an education professional, Ed has this background as a Marine. I've got it in the world of politics, which is on the training aspect. We are getting ready to move forward with a formal credentialing system for patient advocates so that when somebody is working with an AAKP patient ambassador or an advocate, they know that that person has been credentialed. They've gone through a program that produces a certificate, and that there has been a tremendous investment by the patient in getting the skills that they need to be effective. And it's training that we have sanctioned as AAKP and in partnership with our allies. So I'm excited about it. I think it's going to be a great time with many more patients behind it to have the tools they need.
Great. Thanks, Paul. And I know on behalf of the professional team, we're really excited to implement the certification program. So finally, to kind of wrap up our leadership discussion, can each of you share with me and the audience the single most important thing our viewers can do during or after this summit to help advance the AAKP mission and impact our policy? Ed, I'll go ahead and start with you.
Thanks, Diana. I think about this question a lot. I was at a dinner last night, a fundraiser for homeless vets here in Los Angeles, and the gentleman I was sitting next to was the chairman of the group, and I asked him how he got involved, and he said he's a former Army officer, West Point grad, and works out here in Los Angeles. And he said he used to get annoyed when he'd pull up to a traffic light and see somebody with a sign up that said vet will work for food or whatever the sign said. But he said it used to annoy him. And one day he was at a stoplight with his wife, and he said, you know, this really bothers me. And she turned to him and said, well, what are you doing about it? And he said it just stuck with him that there was something he could do. And so he got involved, and eventually he's become the vice chairman of the group. And they're doing a lot to address homelessness here in Los Angeles among veterans and reduce the population. So in the kidney space, if you see an issue that impacts you or a loved one or anyone that you know, and you get frustrated by it, ask yourself, what can you do about it? What are you doing about it? And at AAKP, we have the resources to help you resolve issues and help you address issues with the office holders, the people, the policymakers, anyone who's involved in the kidney space. We can help you reach out to. So get involved in AAKP and take an active interest in your care and your loved one's care.
Thanks, Ed. That excellent point, excellent advice. Richard, I'll go over to you.
Okay, thank you, Diana. And again, I'd like to commend Ed. That was an excellent observation that he made. And what I would say is we have to motivate. There are too many individuals that I run into, and they've given up. They don't have any hope. They're satisfied with their situation. There's nothing I can do. And in order for us to get them engaged, we first have to be in a position of motivating. So one of the things that I enjoy doing is I will go out to support groups when I'm at different organizations, talking and interacting with folks. And many times they will have kidney issues and maybe not be aware of it. They might have high blood pressure. They might have diabetes. And that allows me to begin having a conversation and letting them know that there is something that you can do about it, and you don't have to be alone. So as an organization, we provide such a great service and a great vehicle. Many patients, particularly our friends on dialysis, depressed, anxiety, and feeling alone, particularly during the period of COVID. So again, we must continue to promote our organization individually. I think when someone interacts with Ed, with Paul, and with the staff, they're left with a positive impression. And as opposed to being under the circumstances, they can get on top of the circumstances by joining us. Just taking a leap of faith sometime, joining us, finding out the full breadth and depth of what we have to offer here at AAKP. And that in particular is one of the things that we must do to bring on the next generation of leadership. So I'll turn it back to you, but motivate, educate, and provide opportunities for leadership is what we must do.
That's great, Richard. You are a true mentor. Now, moving over to Paul to kind of wrap it up, what do you think viewers can do during or after this summit to help advance AAKP's mission and our policy agenda?
Well, I can't say strongly enough that what Ed has pointed out and what Richard had pointed out are absolutely true. And the one thing that I would tell folks as you watch through today and you think about where you are, if you're a caregiver or you're a patient, the one thing I think that you can do most effectively is this: question the premise. So if you sit in front of a doctor or a medical professional and they tell you something that you may find devastating about kidney disease or it creates uncertainty, question the premise. Ask them more questions. If you read something in the news about, hey, the field of kidney medicine, there hasn't been innovation for 40 years, blah, 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 and all this type of thing, question the premise. What are they talking about? And do they actually know the most recent information? They may not. We certainly do, because we're in the arena. And what I would encourage folks to do is this: raise your voice. Because for nearly 40 years, there has been a lack of innovation in the kidney space. And part of the reason for that is because many people like to take the mantle and speak for patients. And although AAKP was there, oftentimes our voices were drowned out. That's not the case anymore. You can't have folks sitting at a table pretending that they represent a patient interest when you have a highly effective organization that has so many patient advocates involved that are so highly skilled who can articulate their message. And that's one of the things I would encourage folks to do. Learn the issues, listen, as Ed and Richard have both said, get involved, but remember this, that other people will speak for you if you don't get in the arena and speak for yourself, and you have the power to change things. I've been in meetings, Richard's been in meetings, Ed's been in meetings, where we've watched lobbyists and some other folks talk from a perspective that has no basis in fact about what they think that patients are thinking or what's best for patients. And when we raise a point based on our survey data or based on our personal life experiences, oftentimes the room goes quiet because we have credibility that is beyond anything that you can buy, which is the lived experience and our insights. And I would tell folks that that voice, those insights, must be raised and have to keep being raised in everything that we do. And if you're anywhere in the country and you feel like, wow, I may not have enough experience, no. If you have been encountering and managing kidney disease, either directly or with a loved one, you have great expertise. Just pick up some more skills, get some more information from us, and we will absolutely get you into the arena. And we have to pass the torch. As an organization, we've been around for 50 years. Our founders knew that they wouldn't be there to see the day when so many advancements came, but they created an organization as a vehicle so that everyone could participate going into the future and impacting other lives. That's the opportunity from AAKP. We're 100% patients, and we turn to you and ask you to raise your voices. And I would say that as you watch today and listen, think to yourself what Ed said and what Richard said. What's my role in this? How can I raise my voice? And how can I make certain somebody doesn't speak for me and other patients when I could speak for them? Thanks, Diana.
Great. Thank you, Ed, Richard, and Paul. This has really been a fantastic conversation, and I'm sure has got everybody watching motivated, not only for the upcoming kidney patient policy agenda, but for the rest of today's event, which will help identify and inform key issues impacting kidney patients across the disease spectrum.